Well, today we're talking joint replacements and what can be done on an outpatient basis with Dr. Earl Kilbride of Advanced Orthopedics. Good morning, doctor.
Good morning.
Let's get started with talking about what total joint replacements are done on an outpatient or ambulatory surgery center basis.
Currently now we do mainly knees and hips as an outpatient or an ambulatory surgery center basis. Shoulders are coming along. We expect by January 1st, 2022, Medicare will have jumped on board, and hopefully we can do those as well.
Wow, exciting times now. Can you talk to us about the patient selection criteria for outpatient total joint replacements then, doctor?
Obviously, the healthier the patient, the much easier the recovery, the quicker the recovery. With that being said, we have everyone screened preoperatively with a medical doctor. As long as their medical problems are stable, even if they're chronic, then they can be candidates as well.
Talk to us a little bit about the benefits to having joint replacement done on an outpatient basis.
The first thing is cost. Most people have deductibles that range anywhere from $5,000, $10,000. And so when you get up in those numbers, cost becomes an issue. Surgery centers are much cheaper than inpatient facilities. And so that alone can drive people to surgery centers. The second thing is with COVID, many of the outpatient cases have been driven from the hospitals to the surgery centers because there's not as many sick people. There's more availability of beds and operating room time. And so we do that as well.
Can you tell us what's done for pain control perioperatively so patients can go home?
The main thing with pain control is patient education. We have to get them on board preoperatively, whether that involves using their primary care physician, using a pain management physician, or somebody like myself, just to help them sort through the pain to expect and then the actual pain postoperatively. At the time of the procedure, we use things like regional blocks, we use spinal anesthesia, we use all the same stuff that they use in the hospitals. And then we transition that out as an outpatient. One of the good things at surgery centers is that we can mobilize patients fairly quickly to get them moving and hopefully decrease their pain.
Well, a lot of good information there, doctor. Thank you so much for your time. I look forward to speaking to you again soon.
Anytime, appreciate it.
Learn more about Advanced Orthopedics by visiting their website, advancedpaindoctor.com.